Hello everyone. I'd like to go over an example of a herniated disc. This would be in the lumbar spine, typically presenting with low back pain in your low back. I'll go over what the patient's symptoms are, and of course we'll do a nice video here of the MRI findings. First, a little bit about myself. I'm a neurosurgeon and I've been in practice nearly 20 years now. I did my medical school at the University of Rochester and did my training in neurosurgery in Charleston, South Carolina at the Medical University of South Carolina. And I've been located here in South Carolina, like I said, for almost 20 years. And I've been treating all aspects of the spine, from diagnosing, medical treatment, and of course surgical treatment over these past 20 years. And I'd really like to share with you kind of what you look for on MRIs, and I have a lot of folks who come to me and said they've tried to look at their own MRIs and couldn't quite decipher what meant what. So through these videos I'll have on YouTube here, we'll be able to gain a lot of knowledge as to what MRIs look like and what we're looking for the various disease processes through the spine. I expect to cover neck and certainly low back. So, for example, this first case here we're looking at, this is a 49-year-old female who just happened to be getting out of her car, turned the wrong way, felt a pop in her back, started having pain down her leg. She told me she's been having very severe back pain, radiating down her left leg. It comes down the back side. Worse with activity, maybe gets a little bit of help if she's resting, but just can't walk any sort of distance without getting severe pain coming down into the back of her leg, her calf, down into her foot. She's now even developed a little numbness. This has been going on 3 months. Her doctor put her through what we consider conservative care, which would mean he sent her to therapy, started her on various pain medications, but unfortunately none of it really helped her, and they sent her to me for further review to see if there was any options such as surgery for this. So we'll get right into it. So we look at the MRI, and when I look at an MRI, the two images I like to put up right away is this one you see here on the left, and then the one, of course, on the right. Now on the left, this would be what we call the sagittal image of the MRI of the low back. I tell people this is sort of if we cut you in half and we're looking at you sideways. You'd see this, as opposed to this one is if we laid you flat on your back and sliced you into a bunch of little pieces like a loaf of bread and looked at it straight up. So this is the straight up view and this is the sideways view. This is called the axial view, and again called the sagittal view. Not that you have to know that, but I'll explain it to you a little further. So looking at this MRI here, this would be the skin on your back here. Here's the front side of you, where all your bowels would be in here. This up here would be the top, and of course this is the bottom, such that this little piece of bone, this is bone here, would be your tailbone. Each of these kind of blocks you see here are the bodies of the spine. Blackish areas between these bones are the discs, the intervertebral discs, the ones that cause all the trouble. So in summary, this square block is the bone, the vertebral body, the disc, another vertebral body, another disc, another vertebral body, a disc, and another vertebral body. Now this is considered your low back or your lumbar spine, okay? So this would be the first bone in your lumbar spine, this would be the second, the third, the fourth, and the fifth, and there's just 5 of them. This coming down forms your sacrum, which travels all the way down to your tailbone area. And believe it or not, these are another 5 bones, and you can kind of see some small separations, but they really are fused together, and that happens when you're in development as just a little baby. As we travel further into this, we'll notice these structures here. Now the white is the spinal fluid. And all these little individual strands you see, and they're about the size of spaghetti, are the individual nerve roots that eventually travel out of the spine and go to the different muscles in your legs. So you have the white, and then you have a whole hunk of strands in here, and there's a lot of them, about a dozen or so in there. At the very top is the tail end of the spinal cord. A lot of folks think their spinal cord goes all the way down their back. It actually doesn't. It stops right here, just about level of your rib cage, or just below the rib cage there, such that the only things that come down are just the nerve roots themselves, or these little strands, and they travel down through this sac of fluid. And it's actually an enclosed sac. What happens, though, as we age, you start to get these bulges in the sac, and you can see these little dents here, okay? And that can be quite normal. If they got sizable enough, they'll start impinging on the nerves themselves. Now, when you look at this one here, you say, gosh, it's impinging because it's put a little dent, but it's really just in the spinal fluid. The nerves back here are really just fine. I don't really see any of these bulges touching the back. But let's go deeper into this, since we're talking about herniated disc, and here's really the midline portion. But if we come down to this disc here, again, this square block's bone number 5, lumbar 5 or L5. Here's the disc. Here's the sacrum, which we often designate as an S. So this would be S1, 2, 3, etc. So the disc between bones L5 or lumbar 5 and S1 or sacrum number 1, as we call that, the L5-S1 disc. If I come on, I start panning this a little bit to the left, you'll see there's a big hunk of black that comes in here now. So this is the herniated disc. This black disc, as you see here, is now all the way out into here. So a piece of this has traveled this way, and you can see obviously these nerve roots are sort of taking detours around it. This one probably detours around the other side as well. So it's actually causing an impingement or hitting the nerve itself on that one. If we pan to the right side, you don't see any such thing. It's not coming in. The nerve roots seem to go down just fine. It's really, and centrally, right down the middle looks good. Come to the left side, trouble. So that's the herniated disc on the sagittal view. Let's come over here. So if we took, as you see, this line here and turned it up, you get this view here, okay? So how does this relate? Well, this black, as we've been describing as the disc, would be represented by this round here, this round black here, okay? This would be the skin on the back, because this person's laying flat now. Skin on the back, which correlates to this. Front side, which correlates to this, where your belly is, belly here. Now MRIs are reversed, so this is the right side. You can see the R here. And this is the left side. All right, so person's right, person's left. You can imagine them laying on their back, and you're looking at them from their feet all the way up to their head. So that's why you got left here, right here. This is your belly here, okay? This would be the disc. Here's the bone. This is the little spinous process, or the pointy area. If you ever feel in your back, you feel those bumps. This is what you're feeling. And that correlates to these bumps that you see here. They go all the way up your spine, and like I said, you can feel them on your back when you rub on it, okay? So here's a nice example of that spinous process. So this is sort of the bone here. This is the joint that connects one vertebral body to the next one. They're connected by these joints, and that's called a facet joint. You may have heard that term before. Any event, if you look at this disc, it's a little awkward because it dips way down on the left side here and then comes back. Let's look at one that doesn't dip down. Let's go up to the next one. So here we see the disc right above it, as we see on our sagittal, bone 4, bone 5, L4, L5. So the L4-5 disc, here we go, has a very nice normal contour to it. It's rounded and symmetrical. This sac here, like I said before, the white's the spinal fluid. And now the little nerve roots, which are spaghetti strands, are sort of turned up on end, so you just see them like salt and pepper in here. They're contained in this white sac here. What you notice here is you don't see anything dipping into this white sac. Let's come down to that L5-S1 disc again. And man, you see this big chunk of disc now pushed into this sac. And you can see how it's pushed. Here's a piece of nerve right here. Here's another one there. There's one here, here, here. This nerve is seriously displaced backwards. That's called the impingement. So this would be a herniated disc. Some people refer to them as ruptured discs. I probably would not call this a bulging disc because it's a little bit bigger than a bulging disc. I would refer to this as a herniated disc or a ruptured disc. And it's causing pressure on the nerve root. This is what's giving her the pain coming down her left side. The nerve that comes out the last disc here in your low back is referred to the S1 nerve root. a big contributor to the sciatic nerve. This would be the nerve that travels down the back of your leg. So when she told me she has pain that runs down the back of her leg to calf, this correlates very nicely because this is exactly where the nerve goes. Comes out this space here, travels down the back of your leg, and your calf muscle is controlled by this, which leads to the movement of your foot. If you don't believe me, try it. Flexing your calf muscle and you'll see your foot moves. Or move your foot and see how your calf muscle moves. So this really fits quite well with a herniated disc, and it's a great example of herniated disc, and gives you a little bit of insight as to what we're looking for in an MRI scan. If you have any questions, send me an email. If you have an MRI or X-rays or CT you want me to review, send them to me. Check the links below. Send me an email at DrEsce at spinedoc911.com. As you've seen the links below, and we'll get to it. Also refer to my website for information on how to get all that to me. All right, well, have a wonderful day.